Hi everyone, Merle Goldstein here. Today I'm going to go over a PowerPoint about psychedelics. Since most of us know that psychedelics are a very emerging treatment for different mental disorders, I thought you might be interested in a little bit of a summary of different psychedelics and how they work and some of the ways in which they're helping people. So I'm going to share my screen and go over this PowerPoint with you. This was made by AI. Um, Based on some information that I put in as well as other information that was gathered from the web. Okay, so psychedelics shift brain connectivity. So when people are depressed or anxious, their brain connections are very rigid and compartmentalized, and people loop, and the connections in their brain just kind of loop among each other, and there isn't like flexibility where parts of the brain are connecting to other modes and other networks in the brain. It's just kind of looping in the same places. In a psychedelic state, that changes and the brain becomes flexible and interconnected. So we start making connections with parts of our brain that we don't usually connect to, and neurons start making connections they don't usually make, and it's kind of like new pathways get opened. So these compounds, psychedelics, also boost the diversity and complexity of neural signals, creating cognitive flexibility. So again, the neural signals that happen in depression and anxiety are very rigid and loopy, and they're all just kind of staying stuck together, looping around. And here with psychedelics, we get more openness where suddenly different parts of the brain are connecting to each other in ways that they don't usually connect. Most classical psychedelics also bind to the 5-HT2A serotonin receptor. That's one of the serotonin receptors. There are many of them, which regulates mood, perception, and cognition. So many classical psychedelics also have the effect of affecting the serotonin system in the brain. And psychedelics also produce profound, temporarily altered perceptions of self and the world. Sometimes it's called a non-ordinary state of consciousness. And this creates a biological window for therapeutic intervention. So when people are no longer stuck in seeing themselves a certain way or thinking a certain way or a negative mindset, and all of a sudden they're able to think about themselves and the world in ways that are unusual for them, this gives them an opening for neuroplasticity and for change and for things to get kind of shaken up. It's important to note that because some of these psychedelics affect the serotonin receptor, they can actually sort of like disorganize the brain in a way. The classical psychedelics that affect the 5-HT2A serotonin receptor. And at the same time as it's causing this increased neural diversity and increased flexibility in thinking and ability to make new connections, it could also increase anxiety. And so we want to make sure that, or disorganization of the ego. So we want to make sure that people who use psychedelics don't have a history or vulnerability to psychosis or maybe mania and bipolar disorder. Sometimes people with anxiety might want to be careful about using some of the classical psychedelics. So the idea is that psychedelics affect rigid belief systems. So a lot of people with depression or anxiety or other mental health issues have rumination and negative self-perception. And when we give them psychedelics, the belief systems loosen and it allows patients to revise their trauma or depressive thought loops. So these negative thoughts that people keep having over and over and over again, all of a sudden they can maybe start to think positive thoughts or pull out of that rumination. And psychedelics temporarily disrupt the default mode network. So the default mode network is a part of the brain that's active when we're not focused on an external task. So this is when we're doing something mindlessly and we start to daydream or get into our head or reminisce about something or think about the future. It's kind of when you sort of get lost in your mind or your imagination. And with people that have mental health disorders, a lot of times the DMN is overactivated and is also very negative. So people start to get stuck in going over in their imagination or their mind over and over again how guilty they feel or how bad they feel or how depressed they are. And they can't pull out of that. And the psychedelics temporarily disrupt this or turn it off so that people are able to pull out of that stuckness that they can get into. So just to go over the psychedelics that are being studied right now. So we have psilocybin. It comes from fungi, from mushrooms, and it affects the serotonin. It activates the serotonin 5-HT2A receptors. And this has been shown to help with depression, anxiety, and addiction. I think OCD as well. Then we have MDMA, which is synthetic. So that's created in a lab. It doesn't come from a plant. And this affects serotonin, dopamine, and norepinephrine, and it releases a lot of these chemicals so that the person has a decrease in fear and an increase in feelings of happiness and compassion for self and others. And it's sometimes called an empathogen. It makes you more empathic and it helps people revisit their traumas or feel safer in social situations because their amygdala is basically deactivated and they're not feeling the fear that they normally fear and they're able to trust people more and to feel better about themselves. Ketamine is also synthetic. It's a dissociative anesthetic, and this affects the glutamate system in the brain and can help the brain regenerate. It can help different parts of the brain grow, especially in depression. There are certain parts of the brain that shrink or atrophy, and this can help them regenerate and regrow certain parts of the neuron. And this can help with depression and suicidal ideation, sometimes very quickly. Sometimes people who are suicidal may get one ketamine treatment and they feel better as soon as they're done with the treatment. So it works for about, I believe, 2/3 of people have a positive response to ketamine, but it can be really helpful for depression. Then there's ayahuasca, which is a brew made from a plant together with MAOI, and this can help with depression, trauma, and addiction. There's ibogaine, which comes from a root bark, and this affects multiple receptors and has been shown to be helpful for withdrawal with opioid use disorders. And then there's DMT, which comes from a plant, and this also affects the serotonin 5-HT2A receptor. And this can help with depression and also getting into an altered state or non-ordinary state of consciousness. So classical psychedelics like psilocybin, LSD affect the serotonin 5-HT2A receptor, as we mentioned. This requires deep emotional processing and a disruption of the DMN, the default mode network, and requires intensive hours-long guided sessions. So psilocybin sessions might take, 5 or 6 hours. Yeah, the onset of the effects is usually 30 minutes, and then it usually lasts, 5 to 6 hours. It's important for a person to have someone with them and to be prepared for the experience. Sometimes there could be body sensations that the person is not used to or not prepared for. And it can also increase anxiety. And so we have to prepare people to be able to let go and just trust the process. And when they start to feel somatic things that they're not used to just welcome that and not get anxious about it. Sometimes people may have some dizziness and nausea, but it definitely, psilocybin kind of shakes up the brain and helps people access memories and thoughts and other networks that they're not used to accessing. And sometimes even one treatment with psilocybin can help depression, for example. Ketamine, which is a dissociative anesthetic, it's an anesthetic that makes people dissociate and not feel pain. Targets glutamate, and this promotes rapid neuroplasticity, so new neural connections, without requiring the same level of conscious emotional processing. So you're not necessarily as aware during a ketamine session or afterwards of the different connections you're making or memories that you're processing. Sometimes it can all happen very quickly, or you're just kind of like dissociated, and then when you come out of it, you don't remember everything about it. Maybe you remember certain parts or fragments of it, but it could still help your brain grow new connections and create new pathways, even if you don't have a conscious memory or emotional processing while you're in the experience. And this, like we said, can create rapid relief from treatment-resistant depression and acute suicidal ideation within hours. And the FDA has approved esketamine, which I believe is a mirror molecule to ketamine itself. It's called Spravato, and that is a nasal spray, and it has a similar effect to the ketamine and has been shown to help depression. So psilocybin is the magic mushroom medicine. It comes from 200 or more fungi species. We said it binds to the 5-HT2A receptor, and it disrupts the DMM rumination loop. People sometimes have significant lasting symptom reduction in depression, even after just one single dose. And it's also highly effective for end-of-life anxiety. People often have mystical experiences when they take psilocybin. People that have terminal illnesses have been shown to lose their fear of death or start believing in an afterlife after an experience with psilocybin. MDMA, like we said, is an empathogen. It makes you more empathic. It makes you feel compassion. It's created synthetically. It floods the brain with serotonin, dopamine, and norepinephrine, dramatically reduces the fear response. And this is very helpful for PTSD because in PTSD, a lot of people are not willing to expose themselves to their traumatic memories, especially if their traumas, if they have combat trauma or were assaulted or raped or, very severe traumas. People are often afraid to do exposure therapy or to revisit those traumas to reprocess them. And so this basically decreases the fear associated with the trauma and also connects the trauma processing with feelings of love and compassion and trust for the person you're with. And so this has been shown to be very helpful for PTSD, and it's an FDA breakthrough therapy for PTSD. They found in phase 3 clinical trials that 67% of participants no longer met PTSD diagnostic criteria after the treatment. So with MDMA, it's the clinical trials included a lot of therapy, similar to IFS therapy, a lot of it, in addition to the MDMA itself. So all of these experiences, the psychedelic itself can have its own biological effect on the person, and then sometimes there's also a therapeutic effect based on the therapy the person is getting at the same time. These are some plant medicines that people used for many years in different places. Ayahuasca, ibogaine, and DMT. So ayahuasca is, very common in the Amazon. It's an Amazonian brew. It has DMT plants and MAOIs, which help the plants break down. There's 4 to 8 hours usually of intense visual and emotional introspection, and it's been shown to help for depression, trauma, and addiction. Ibogaine comes from the iboga root. It's a 12 to 36 hour waking dream state. It has cardiac risks, so it's not FDA approved at this time, although they're finding that it can very dramatically interrupt opioid use disorder withdrawal. So it can help with withdrawal symptoms for people that are addicted to opioids. And so they're doing a little bit of studies on that. And then there's DMT, which is a short-acting inhaled 5-HT2A agonist. The experience lasts 5 to 20 minutes. Sometimes people just have a rapid, vivid breakthrough visionary state. And they are studying this for depression and anxiety as well. So the substance is a catalyst, not a cure. So what happens is psychedelics open a profound window of neurological plasticity and emotional openness, and we have to help our clients use that for transformation. So it's not enough usually to have, maybe with ketamine, it would be enough without this, but for depression. But in general, when people use psychedelics, it gives them an opening or a window for transformation to happen, but they still have to do the work of therapy and processing and integration, making certain active, concrete changes in order to make use of that window of neuroplasticity. So usually we say that a person should have a therapeutic container, therapeutic relationship in order to prepare for their psychedelic experiences and also integrate them afterwards and turn them into action that people can take to create actual changes. So a lot of times what we do in terms of creating a therapeutic container for psychedelic work is we think about the set and setting. So the setting is where and in what environment is the person going to take the psychedelic medicine, and who will be present with them, what is present in the environment, whether they need anything comforting to them, or certain smells can sometimes be used, aromatherapy. An eye mask someone might have. You want usually it to be a low stimulation, very calming setting and a safe setting for the person. And the set is the mindset of the person. So what are they going in wanting to accomplish? And what is their frame of mind when they're thinking about their medicine session? Then there's usually a trained guide. This is a certified facilitator who's present through the experience to support the patient. And then integration is somebody helping the person to process their insights from their psychedelic experience afterwards and turn it into change. So in integration as therapists, we don't want to say as much as we would normally say, like interpretations or telling clients what we think something might mean, but you really want to let it come from the client for them to be able to sit with some uncertainty about their experience, or maybe some insights they had that they're not 100% sure what it means. We don't want to rush to explain it. We want to just let the client kind of sit with it and see what they come up with after the session, maybe journaling or doing some artwork, spending time in nature, listening to the music they were using during the psychedelic experience, which is a very big part of it. Those are things that help a person, kind of use what's coming up to make certain changes, but we don't want to prematurely close things off with us saying too much as integration facilitators. And we find that when these steps are skipped, then the patient risk of having a difficult experience or an experience that they don't find helpful afterwards increases. Okay, so just to summarize, the paradigm shift is moving away from managing symptoms towards facilitating deep lasting neurological shifts in a finite number of sessions. So psychedelics hold the promise of being able to create actual lasting change in a short amount of time because it's able to disrupt the brain, right? Like a snow globe that you shake up, and all of a sudden everything is in a different place than it was before. And this gives a person an openness to something new. Dozens of phase 2 and phase 3 trials are actively underway globally. So we're going to see more and more places where these treatments are available to people and are legal for people to use. In Colorado, there's psilocybin is legal under certain conditions. I'm actually training to become a psilocybin facilitator in Colorado. I believe that other states will legalize psilocybin for therapeutic use as well pretty soon. We have trials on MDMA. We have a lot of trials going on that are going to make these medicines more accessible to people. And it's very important to be very ethical when we work with psychedelics, to make sure that we get informed consent, that we prepare the clients properly, that we discuss any issues around whether touch will be used and under what conditions, that no one, violates the trust of the person who's in a more vulnerable state while they're taking psychedelics. So we want to be careful about that as well. Okay, that's it for now. If you have any questions, feel free to let me know.